right, so part of our Catalyst soccer training methods has a lot to do with lowering the risk of injuries. But injuries, that's why we don't use the term injury prevention, because you can't always prevent them, especially when players are going through their growing years. They're going to have certain strains and pains, but there's definitely injury management and recovery that can be done by a Catalyst soccer trainer with their player. So I've got Cody today, and he's been having some pains in his knee from a condition called Osgood Shlatter. And this, what we're going to do is also helpful if you've got patellar tendonitis and some of those other things that are essentially, when you boil it down, it's inflammation in the knee, and it's causing the kneecap or the muscles and the tendons to not work the way that they're supposed to. So what we're going to start with is I want to evaluate his flexibility and see if this Osgood Shlatter pain is being caused by something outside of the knee. So what I'm going to have him do is he's going to sit up against this table here, and he's just going to put the edge of the table right at the top of his tailbone, and he's going to lean back, and he's going to pull his knee to his chest. Good. And he's just going to relax his head, and he's going to try to relax his leg. So if you look closely, this is his leg relaxed. His knee is about 1 or 2 inches higher than his hip, and his leg here is fully extended. Even if I push down on it, okay, there we go. We got it to relax a little bit. So if I were to push down on it and it was really tense and I couldn't get any flexion out of that knee, I'd be very concerned. So the fact that his knee's been able to relax and get flexion there is good. But ideally what we want is for that knee to actually sink lower than the hip when he's letting it hang off the edge of the table. Now, does this feel like a big strain? Does it feel uncomfortable for you? Yes. So this is uncomfortable for him to just let the natural weight of his leg hang from the table. So, okay, go ahead and sit up. All right, now just scoot all the way back here. Keep going, keep going. There you go, just lay back. Okay, so now what we want to do next is test a little bit of his back range of motion, because again, it's all a system that's connected. We've got his hip flexor that connects to his quad, that connects to the patellar tendon that wraps over the kneecap. But up here at the hip flexor and the hip joint is where the muscles in the back, particularly the psoas, that is very close to the spine, and it connects to the head of the femur. We want to see if that is also tight, because when we have one thing here, it's most likely going to affect the entire system. So it's your left leg, correct? Okay, so scoot towards me a little bit. Okay, so all we're going to do is we're going to pick up the knee that is feeling the pain. We're going to rotate it across his body. I just want you to let it relax. He's going to relax his head. He's going to relax his shoulders. And all he's going to try to do is just let that leg drop all the way across. And what I'm looking for is a little bit of that squinting in his face, where I can tell that this is causing some discomfort for him. So we're going to bring it back. So now I want you to bend your knee. Just let your leg relax. There you go. Straighten that arm all the way out. Good. And let's do it again. So now with that bent knee, just let it go as far as you can, just on your own. Keep rotating, keep rotating. Good. I want you to keep going until that knee touches the table. Good. Now as he does this opposite shoulder is now more than a hand's width off the table. Okay, so let's bring it back. So now I want to keep that shoulder flat. I'm going to push on it. And now we're going to do the same thing. We're going to see how far that knee can go without that shoulder coming up. Keep going, go as far as you can. And he's straining, so it's no longer feeling like a comfortable stretch and a good release, but it's more of a pain. All right, go ahead and stand up. And let's come off the edge of the table now. All right, and let's just take that left foot and put your toe to the edge. Good, just hop forward a little bit. There you go, and I just want you to lean your shoulders back. Good. Okay, so now with this one, sometimes when they're really tight, they have a hard time grabbing their foot and pulling it up behind them. So being able to use a table just allows them to relax that foot there and just relax their body weight into it. So this will get a much deeper stretch out of that hip flexor and that quad. And then what he's going to do is he's just going to do little squats on this leg. So he's just going to bend that knee, drop down a little bit, and come back up. Drop down, come back up. And he's just going to do that a few times, and that's just going to get it even deeper into his hip flexor. Good, and just go ahead and set it down. Good, and relax. And one more time, go ahead and get up on the table there. Okay, so those first two exercises, those are ways to evaluate what is tight, and then he can continue to do those as regular stretches on his own until it loosens up. That one is another one for him to do as a regular part of his routine for stretching. One of the reasons why the hip flexors and the quads get so tight is because soccer is a very quad dominant sport. And so these muscles get overdeveloped and we don't have a balance of strength on the backside. So now I want to also show him a strengthening exercise that's going to help with the hamstrings and the glutes to take some of the stress off the muscles that are front loading and be able to load it on the back, on the posterior side of the body as well. So now he's going to lay back and he's going to bend his knees. Just bend them. There you go, just like that. And so all he's going to do here is a bridge. So push your button back up as high as you can. So as he bridges up, I want to see his knee, hip, and shoulder in a nice straight line. Now come down and relax. Good. And as he does this, I want him putting the pressure into his heels, not his toes. That's also going to get the hamstrings and the glutes to contract more than the calves. Okay, so do it again. Push up nice and high. So now we've got his toes up off the ground. We're maximizing what those hamstrings are doing. Lower down. And now we're going to do it on a single leg. So he can hold one leg up in the air. Go ahead and bridge up. Good. And come back down. Go up. Come back down. Relax. So right now he's got his elbows flat on the table. That's perfectly fine. Other ways you can relax. To progress on this is to put a soccer ball underneath his feet. So now he's having a balance component. We're making the muscles work harder. And then when that also gets easy, then we can take the arms out of it. He can cross his arms over his chest. So now he has to activate his core a lot more to keep that balance and control as well. So the last thing to say about the Osgood Shlatter, there are these straps that players will put around their knees, and Cody does have one of those. Those are helpful to put compression on the spot where there's a little bump that forms on the front of the knee. So the straps are good, but they're not going to cure it. They're not going to make it go away. You're not really working on what the source of the problem is. You're kind of just working on the symptom of it. So as you could tell by the exercises that I did with Cody, most of it had nothing to do with his knee. I wasn't manipulating the kneecap, wasn't massaging his knee. It was everything else in the entire system of his muscles and tendons that were causing so much tightness and putting the extra strain on the knee. So then his kneecap is not rotating correctly in that joint, and then it's causing a lot of friction, which causes the inflammation and then causes the pain. The last thing to note with it is I get questions about whether it's going to happen on the plant leg or their dominant kicking foot, and it really just depends player to player. For some, because for Cody, for example, his left leg is his plant leg, so that leg is taking a lot more impact as he's stepping on it to strike the ball and pass the ball, and so those muscles are working a lot harder and differently than what his right leg is doing, whereas right leg is doing a lot more range of motion, so it is staying a little bit looser. With other players, it may be the opposite. Because of how much work the right leg is doing to manipulate the ball and do the passing, the right leg may tense up more than the plant leg. So it's not necessarily the same for every player. It's definitely a case-by-case scenario. But if any of you are experiencing some of those same knee pains, patellar tendonitis, Osgood Shlatter, these stretching exercises and the hamstring and glute strengthening that I did with Cody will be really good for you to implement at home as well.